Hello and welcome back to Patient Knowledge. My name is Dr. Kirmani, and this channel is all about health education. For my new viewers and subscribers, I would like to mention that on every weekend I upload new videos related to various health topics. And today I will be talking about a common sleep disorder called Restless Leg Syndrome. Would you like to know more about it? So let's get started. In this video, I will be talking about what's restless leg syndrome, who gets it, what's the cause, what are the symptoms, are there any complications, and how can we manage it. Now, what's restless leg syndrome? It's a condition where a person feels as if they want to exercise or move when the body is trying to rest. It's also known as Willis-Ekbom syndrome. It's one of the most common sleep disorders and a neurological disorder as it affects the brain. The most common complaint of people affected with this condition is the disruption of sleep and certain relaxing activities. These people have problem having prolonged car drive and plane travel. It becomes extremely hard for them to remain at one place for a long time because their legs get restless. Now, who gets it? It can affect anyone. About 15% of people experience this at bedtime and hence can lead to sleep problems. Its prevalence increases with age, mainly affecting the elderly. Women are more likely to get this condition, and it's aggravated by pregnancy. Well, it can be hereditary, which runs in families and can affect children. In children, it's hard to diagnose and is often misdiagnosed as it can be confused with ADHD. Or it can be as a result of certain medical conditions or due to use of certain drugs. Now, what's the cause of restless leg syndrome? Well, the exact cause is unknown. Scientists say that there could be some problem with the chemical transmitting substance in the central nervous system. It's not at all related to any excessive exercising or doing any kind of strenuous work. Recent studies show that people suffering from this condition have got low levels of iron in their brain. Now, there are certain medical conditions that can lead to restless leg syndrome, such as iron deficiency anemia, kidney failure, hypothyroidism, and pregnancy. There are certain medications that can also cause restless leg syndrome. So all the anti-medications such as antihistamines, antiemetics, antidepressants, and anti-epileptics can cause this. Certain tranquilizers and some drugs that are used to treat hypertension are also found to be responsible for causing this condition. What are the symptoms of restless leg syndrome? Well, the term is self-explanatory. People who suffer from this condition have an urge to move legs at bedtime. They have certain unpleasant sensations in their legs, which they are sometimes not able to describe. But many people say that they get some kind of sensations that can be crawling, creeping, prickly, tingling, itching. There can be contractions, burning, pulling or tugging, electric or shock-like. Well, it can vary from minor irritation to severe disability. Symptoms get aggravated by warmth or heat, and people who experience this get periodic jerking limb movements during their sleep. What are the risks of restless leg syndrome? Well, it's not a serious life-threatening problem and does not have any complications. But there can be issues at work, leisure, personal, or relationship. People who have this condition are mostly depressed or have suicidal tendency as well. It has social and psychological effects. Now, how can it be diagnosed? Well, if you suspect that you could be having restless leg syndrome, it's time to see a doctor. There is no specific test to diagnose the condition. However, the diagnosis is only clinical based upon the criteria for diagnosing depending upon the symptoms that a person complains of. The doctor may also order iron studies because many people who suffer from this condition have got low levels of iron in their blood. Well, the criteria for diagnosis is depending upon the symptoms. So the symptoms must be all of the following: uncomfortable sensations, a strong impulse to move your limbs, symptoms that get worsened at night and worsen at rest, and there's feeling of restlessness. Now, how can we manage this condition? It can be managed through self-help and medication as well. Self-help includes lifestyle modifications, which can be done easily by changing to healthy diet, quitting smoking, cutting down on alcohol and caffeine, practicing good sleep hygiene. Some people find it quite useful to involve into certain activities that reduce symptoms such as walking, massage, and certain type of exercises where you are stretching your calf muscles at least 5 to 10 minutes before retiring to bed. Try keeping legs cooler than the body before sleeping. Some people find hot baths quite comfortable and relaxing. Well, pneumatic compression devices are quite useful. These are inflatable wraps that are put around your legs to improve blood circulation. Regarding medication, there are certain options available. So if the above things do not work or these measures are not useful, one can use certain medications such as Panadol, taking 2 tablets before going to bed. Some muscle relaxants can be useful. Of course, iron supplements play a major role in improving the symptoms. Codeine and levodopa are also useful. Well, avoid antihistamines and tranquilizers and other over-the-counter medication. That's all for today. I hope this information was useful in understanding everything about restless leg syndrome. So if you suspect anything like that, do not suffer. See your doctor and get it fixed easily to improve the quality of life. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Bye for now.